Hi, welcome to my channel. It's Dr. Erica. Please like, share, and subscribe to my channel. I'm happy that you're here to join this live chat. If you have any questions, comments, please feel free to leave any suggestions, comments, questions. I'm Dr. Erica for over 12 years now, as of 2025. Thank you for joining me. This channel is a supplemental channel to my main channel, Erica OnagbolaPharmD. Now, the previous video that I uploaded was talking about cancer screening, cancer prevention. There's a timeline at which one should go about getting tested and being screened. I briefly went over some suggestions as to when a patient should be screened for certain cancer prevention. For example, colorectal examination has to be done at least or around about the age of 45 and above. Once upon a time, it was 50 years of age. Now it's been reduced to 45 because of the ongoing younger generations who are now experiencing a lot of the abnormal growth of polyps and cancer in the rectum. So again, 45 years of age and older. There's also for breast cancer, for example, female patients should receive a monograph examination at the age of 40 and above. There's also a suggestion for patients to have their blood pressure checked. Having your blood pressure checked can help reduce the chances of having abnormal cell growth later on. You want to prevent. So, a sign of cancer can be increased blood pressure, also abnormal bleeding or excessive bleeding. So, once you at the age of 30, 35, start getting your blood pressure checked from your primary care physician, they should be able to detect signs and symptoms related to the cardiovascular system that can cause or can give them a sense of how well your blood flow is occurring in your internally. Tumor cells or cancer cells, they sometimes begin to fabricate blood vessels. They begin to create their own system of blood cell growth and blood cell vessels in order to feed these tumor cells so that they will have their own particular source of flow of blood. So that increases your blood pressure, that increases um, blood perfusion or bleeding. So, again, being tested or screened at the recommended time frame can help reduce long-term risk of tumors and growth of these cancers. Another sign and symptom is swelling of lymph nodes, bulges, also inflammation. Abnormal inflammation, abnormal growth can be signs and symptoms of cancer. It could mean that there is extra tissues that have been grown, which could be the tissue of the cancer itself. It could be the extra blood vessels that have grown around these tissues. It could mean that these tissues have grown to a later stage to where they're now being seen above the surface of the skin, or they're being seen underneath the surface of the muscle tissue, to where you now have a full out, blown out tumor or bulge. Women deal with having to having the risk of cervical cancers. Every year, females who are sexually active, especially those who are sexually active, should receive a pap smear, which is the female testing of cervical cancers, as well as endometriosis, as well as fibroids of the uterus. That screening should begin, especially in women who are sexually active. Once every year, this screening should occur. I want to reiterate, especially in women, again, the monograph examination starts at the age of 40. Cervical cancer screening should begin testing should begin every year. And then also, there's other testing that a female can do for breast cancer detection at home, such as the self-examination, the self at home female examination. Um, Also, skin cancer, be mindful on a regular basis of mole growth, of skin tags, of discoloration in the of the skin. Just being mindful of the types of chemicals we apply to our skins. We want to use antibacterial soaps. We want to use moisturizing soaps without the harsh chemicals, without harsh ingredients. We want to use water-based products with, again, antimicrobial functioning, and also those with moisturizers to help reduce the risk of cancer. Also, I want to mention about bone health. Bone health or bone cancer is a state in which maybe stage 3 or stage 4, where cancers um, have grown or advanced to where now the bone itself is affected. So I want to make mention of bone health. Proper bone health um, can be supplemented with vitamin D and calcium, and it can also be supplemented with our consumption of these items, vitamin D and calcium, which is found in our dairy products and our fruits and our vegetables. And also, it can be supplemented with daily one a day supplements as well. And then also, um, exercising and weight training can help our bones become stronger and more dense and more durable, reducing the chances of bone disease or bone cancers. Men have to, at a certain age, be more aware of their their risk of colorectal cancer and also prostate cancers. Men should receive their prostate examination at least by the age of, I want to say it's 40 for men for prostate examination. Now, the risk of prostate cancer increases with age. There has been there has been in the past maybe a chance of being susceptible to prostate cancers at earlier ages, but the start, according to the recommended guidelines, is age 40, I want to say, for prostate examination and cancer screening. Lung cancer. Lung cancer, if you are someone who um, consumes tobacco or someone who regularly uses tobacco, I recommend that you receive a um, aspiration exam with your PCP, your primary care physician, and nursing staff to learn more about your your risk of developing lung cancer. As you know, tobacco use can increase the risk of chronic obstructive pulmonary disease or COPD, bronchitis, and asthma as well. Now, long term use of tobacco products can cause initiation of cancer. Also, liver cancer can be detected as well through blood work, blood labs, laboratory examinations that are done with your PCP and specialist if follow up is required. Other cancers that I want to make mention of can be prevented sometimes through vaccinations. Sometimes it can be prevented through exercise and proper dieting and supplementation. So I just want to make mention of that as well. There are, again, vaccinations that are available, such as vaccinations for the lung health, for breathing health, for reduction of certain diseases related to the lungs, certain diseases related to the heart that I want to mention. So please speak. You can speak with your local pharmacist as well to find out what medications you qualify for, which vaccinations you do qualify for, and also talk with. You can also talk with your primary care physician as well to find out which medications would be the best route for you to take in order to prevent your chances of developing cancers as well. Are not gender specific, but are just for general populations, for those who have an age or comorbid condition, if I may say. Thyroid cancer, um, again, I mentioned the bulging of below the skin. Um, that's a true sign of thyroid cancer. Screening can occur with your primary care physician or specialist, and um, there are some signs and symptoms like lethargy, fatigue. There's also other symptoms that you can develop that will help determine whether you are feeling symptoms of these cancers. Bladder cancer, I've noticed, is more prevalent now. Bladder cancer has occurred here in the media more recently, especially I want to say, a lot of celebrities here recently are dealing with have come out to say that they've had bladder surgery removal or they've been diagnosed with the disease just because of bleeding. Bleeding in the urine, having red blood cells being found in the urine is a prime example of bladder cancer. Prevention treatment and screening can occur with symptoms and those signs of bleeding and abdominal pain, kidney um, filtering out through the kidneys. That may be a sign that it may be related to the kidneys, but there also may be some sort of connection with the bladder as well. So you do want to, at the earliest sign of dark urine, consistently dark urine, even when you're drinking plenty and plenty of water, which helps clear out the urine. If you're experiencing a lot of red dark urine, that is a sign of possibility of cancerous tumor cells in the lining of the bladder. So do please take that in consideration. There are, I didn't mention too much about skin cancer. I just want to make sure that I do mention, just to be aware of what you're putting on your skin. Um, a lot of the tanning lotions and tanning beds have been known to cause skin cancers. I would rule that out in any type of cosmetic or any type of beautification process. I would just rule that out, not to go that route. um, there's laser surgeries for the skin. There's a lot that could cause skin cancer. So I would be aware of those risks, and I would be cautious about any growth, any discoloration, um, that you're not aware of, any allergic reactions, anything that you're allergic to. You might want to get an allergic testing to be done with your specialist or your primary care physician again, and just rule out any possibility of skin cancer growth. That could be a mole. It could be a elevated or discolorated um, you know mole or growth that wasn't previously there. It could also mean that there may be something under the skin that could be causing discoloration as well. Um, at the first sign of this, I would definitely reach out to dermatologists um, to detect early stages. The earlier the detection, the better chance of survival and prognosis. So do please be aware of that as well. And there are also medications. When you receive your medication, make sure you read the fine details of the risk of cancer, the risk of the level of its carcinogenic effects. You want to be aware of what it actually, what the medication actually does, not just the side effects, but its level. The medication actually does, not just the side effects, but its level of cancer risk. Does the benefit outweigh the risk? Am I susceptible to developing cancer? If you have a family history, a known family history, or um, a known cancer development in your family, that is a risk factor for your own particular case. You just have to take in consideration, um, take in consideration your health history as well as what you dealt with in your family. So I've mentioned plenty of screening details. I just want to, as a healthcare provider for 15 years, 12 years official license practicing, training, possibly 15 years now, the least I could do is share this information with the public, give this information back to the people. Um, not, necessarily um, looking for anything in return, but giving this information back to the people where it belongs. And as a healthcare provider, I took an oath. I took an oath in 2013 that I would protect my community, protect and be accountable myself for what could possibly happen, with medications, without medications, being knowledgeable and continuing with my education without, without being in a collegiate atmosphere. When I'm at home, what am I doing? What am I doing to help, my community, help, the public, my contribution, and I want to be held accountable for that, and that's what I'm here for, and that's why I initially started my page, my main YouTube page, and the supplemental page as well. So I'm glad that you're here. I'm glad that you're watching. If you have any questions, any concerns, please feel free to reach out to your pharmacist, if not your pharmacist, your nurse staff at your physician's office, your specialist. Be in communication. There's nothing that you can't disclose with someone that you truly trust. If you're not in a trusting relationship with your PCP or your nursing staff, seek a second opinion, and feel free to talk with your pharmacist. If they're not an honest pharmacy or pharmacist that you trust, then I recommend that you, again, continue moving forward until you do find a a pharmacy that you're comfortable with. So be mindful of that. And I'm glad you're here joining me. Please like, share, and subscribe. This is Dr. Erica, pharmacist, and I hope to see you on the next go round. Take care. Bye bye.